infection is harder to detect. Yes or no?
Yes.
Okay. The elderly patients may have a typical presentation of fever or may not develop a fever despite a serious infection because of the reason that we first stated. Alright. Elderly patients. Okay. Now we are going to the infants. The infants, especially the neonates, have immature immune response and may not mount a significant response to fever. So fever in infants can be a sign of a serious infection and requires careful evaluation. Both groups are at higher risk of complications from fever and infections. So we are going to the next, which are the clinical stages and the principles of fever management. So the clinical stages of fever, part A says, prodromal stage, we have the onset of chill stage. This is the onset of chill stage. We have the flash stage. Then we have the effervescence stage. So in the prodromal stage, we have initial symptoms like chills, headache, and malaise. Serious doctors like you know all what everything that I've stated means. So because of that, we shall just press next. When we go to the chills, when the temperature rises, the patient feels cold and the shivers. When we go to the sunny stage, which is the flushy stage, the skin becomes warm and flush as the temperature peaks. Then when we go to the effervescence stage, temperature returns to normal and the sweating occurs. Are we following? I don't want to leave anyone behind. All right. So let's go to the principles of management. The first principle says, identify and treat the underlying cause of fever. The second principle says, use antipyretics. When we talk of antipyretics, we are referring to things like paracetamol, ibuprofen, that help to reduce discomfort. Okay? The third principle says maintain hydration and of course take some time to rest. Monitor for signs and complications or worsening conditions. And lastly, avoid unnecessary use of antibiotics unless bacterial infection is confirmed. As I go, of course we all know that some things can defeat man. But with God, all things are possible. I beg you to end there. May God bless you.